right, let's talk about something that is way too often left in the dark. We're going to break the silence and cut through all the myths to get to the real, science-based facts about male sexual health, the stuff everyone really deserves to know. So, just think about it for a second. What did you actually learn in school about taking care of your own body? For most guys, there's this huge, massive gap when it comes to sexual health. And look, that's not a personal failure. It's just the way things have been for a long time. And this quote, it just hits the nail on the head, right? This is such a common experience, and it creates this cycle of quiet anxiety, frantic late-night Google searches, and some seriously dangerous misinformation. And today, we're going to break that cycle. So let's just set the stage here. This is a completely shame-free zone. We're not dealing with myths or opinions. We're just sticking to the facts, what the real science and the doctors are seeing, to give you the clear information that every guy and, frankly, every partner should have. Okay, so first up, let's tackle why this conversation is so incredibly important. It's because the silence itself, well, it can be a genuine health risk. You know, when we don't talk about this stuff openly, guys are pretty much left to figure it out on their own. And that usually means falling down some internet rabbit hole, landing in anxiety-filled forums where really bad advice gets passed around as fact. That can lead to real harm. And honestly, if you only take one single thing away from our entire chat today, please let it be this. If something feels off, if there's pain, if you notice a sudden change, talk to a doctor. They're professionals. They have seen it all before, I promise you. Embarrassment should never, ever get in the way of your health. Now, that anxiety we just mentioned, it often pushes men toward things that seem like easy solutions online. But these so-called quick fixes can be incredibly dangerous. And that brings us to our second point, these shortcuts that can cause real, lasting harm. So you go online, and you see all these wild promises of permanent growth and thicker results. But then you look at the medical reality, and it's a completely different story. Using these devices without a doctor's supervision can lead to permanent nerve damage, scar tissue, and even a permanent curve. It's just not worth the risk. This quote really says everything you need to know. It's not a muscle that you can train with weights. It's an incredibly complex and sensitive system of tissues and blood vessels, and treating it with brute force is, well, it's a recipe for disaster. And hey, another one of these popular shortcuts you see everywhere are numbing sprays. They might seem like a solution in the moment, but they don't fix the underlying issue. And over time, they can actually lead to a permanent loss of sensation, affect your erection strength, and can even transfer to your partner. It just masks the problem. Okay, so beyond the risks of those so-called shortcuts, there are also acute accidents and more subtle warning signs that you really need to be watching for. Knowing what they are can be absolutely crucial. The term penile fracture sounds absolutely terrifying, I know, but it's a real medical emergency. Now, it's not a bone breaking, it's actually a tear in the internal tissue, and the signs are unmistakable: a sudden snapping sound, immediate pain, and a very quick loss of the erection. Let's be crystal clear about this. This is not something you can just walk off. The only correct response is to stop everything and get to an emergency room right away. Getting prompt treatment is absolutely essential to prevent permanent damage. And it's not just about those sudden injuries. You also have to pay attention to the more gradual changes. You know, a new curve that wasn't there before, a strange lump, or pain that just won't go away. These could be signs of things like Peyronie's disease, and the sooner these things get diagnosed, the better the outcome. All right, this next section is so important because it really shows how your sexual health can act like a check engine light for your entire body, especially when it comes to your heart. So, morning erections, they're not just about sex. They are a vital sign of healthy blood flow and nerve function. If they start to become less frequent or stop altogether, that can be one of the earliest warning signs of bigger systemic issues like heart disease or diabetes. This is just such a powerful way to think about it. Research actually shows that erectile dysfunction can show up years before other symptoms of heart disease. It really is your body's check engine light, telling you it's time to see a professional and figure out what's going on under the hood. And our lifestyle choices have a direct, massive impact. Just take smoking. It damages the tiny, delicate blood vessels all over your body, including the ones that are essential for healthy erectile function. This is exactly why it so dramatically increases the risk of dysfunction. Yeah, just look at that number. Smokers are 2 to 3 times more likely to deal with this. That is a huge difference. But there's good news too.
Quitting often leads to real, measurable improvements as your body starts to heal itself.
And beyond those big lifestyle choices like smoking, even the small everyday things that we do can have a surprisingly big impact. Let's talk hygiene. It's all about balance, right? It's a Goldilocks situation. Too little can lead to problems, but too much, especially with harsh soaps, can strip away the skin's natural protective oils and cause a lot of irritation. The right way is usually the simplest, just gentle washing with warm water.
And we absolutely cannot forget the mind-body connection. They are not separate things. They work together. High levels of stress and anxiety release hormones that physically constrict your blood vessels. This can make erections unreliable. Sometimes the problem isn't physical at all. It's a sign that your brain is just feeling totally overwhelmed.
And, hey, here's something super practical that often gets overlooked: condom fit. It's not just about safety, it's also about function. If it's too tight, it can be painful or restrictive. Too loose, and it can slip. Taking a minute to find the right size is really essential. All right, so we've covered a ton of ground. Let's pull it all together now into a really clear, actionable playbook. These are the science-backed steps you can take to protect your health for the long run.
And look, none of this is going to be rocket science. It's the same advice you hear for protecting your heart. Because guess what? It's all connected. Regular exercise, a healthy diet, managing your stress, and avoiding smoking, these are the foundations for every single system in your body.
And if we can just leave you with one final thought, one single rule to rule them all, it's this: your body is really good at telling you when something is wrong. Your job is to listen to it. Ignoring a problem doesn't make it disappear. It just gives it time to get louder.
This kind of knowledge shouldn't be taboo. It shouldn't be a secret. Breaking that cycle of silence really starts with sharing good, factual information. So ask yourself, who in your life might need to hear this? Thanks so much for joining us.